Tony O'Sullivan, co-chair of the Keep Our NHS Public campaign, also a retired NHS paediatrician. Dr. O'Sullivan, thanks so much for joining us this evening. What do you make of this plan?
Hi, Lewis. Thanks for having me on. Well, I share your scepticism that it's underfunded. I've only had a short chance to look at it. I think it's very sketchy on detail for saying, what is needed, specialty by specialty, numbers of doctors, numbers of consultants, numbers of nurses, numbers of therapists. It's very, very weak so far from what I've seen. It's one of these situations where if there's a plan, I wouldn't start from here. The government halted medical school planning in 2010 and cut nurse places by 4,000 training places a year. And then in 2017, it abolished the student bursary for NHS students. So there's a lot of damage that has been done by this very same government. And I think one thing that it absolutely does nothing about is address the current situation here and now. So the first hint of anything changing will be in 2 years' time. I think the fact that a BMA poll published at the end of last year said that 40% of junior doctors are planning to leave the NHS as soon as they're offered another job, and that 9% more nurses left the NHS in 2021, and that increased again the following year. And we have 112,000 vacancies right across the health service, from mental health to hospital care to GP. And I think the one thing that the government could do would be to pay NHS staff now to help stop the hemorrhaging of staff leaving the NHS and to improve morale.
I know you're a retired NHS paediatrician now, Dr. O'Sullivan, but I mean, you must still have a lot of colleagues in the service. What are they saying to you about the situation at the moment?
One of the things they're saying is that after many years of attrition now, there's a huge increase in responsibility on the consultants. The trainees are less experienced, they have less time to train, there's not enough staff. I think when I was still in work, one of the things we had to put up with was the cutting, for example, in paediatric training posts at a time when we knew there was a need for expanded consultant posts. And we've seen that now in other areas, haven't we, like cardiology and anaesthetics. There is just insufficient consultant available, and yet the training posts aren't getting the jobs offered to them. And one of the results of insufficient doctors and nearly 8,000 vacancies is that £3 billion a year is being spent on private agencies filling posts, something that you referred to earlier on. And if you look at the amount of money offered, 2.4 billion over 5 years, and I agree with you, and compare that with £3 billion a year being wasted on private agencies, I think the government has just got this wrong. If they wanted to improve the situation immediately, they would actually pay the staff some of the value that they've lost in their real value pay over the last several years, and just respect them again and get them to say, we want to work for the NHS, we want to stay in the NHS because that's where we know we're doing a really good job for the population and we're getting paid for it properly.
Obviously, the government has put great store by saying today that this is the NHS's plan, that this has been developed by the NHS and the government is backing it. Yeah. What do you make of that claim, in the sense, of course, the NHS may well have devised the plan, but of course ultimately it's the government that controls the purse strings, so they can only operate within whatever parameters ministers set.
You're absolutely spot on there. I think one of the reasons any form of workforce plan has been delayed for so long is that the government, and in particular the Treasury, has refused to underwrite the cost of this expansion. Of course, I welcome the fact that there is some kind of plan available, at least we can start talking about what the plans are. But the government has time and time again refused really to address the real terms increase in funding for the NHS that is needed to turn the whole thing around. And they're permanently using sound bites about the greatest investment ever, whereas we know that the real terms funding per person has actually fallen for the first time in this last period, for the first time ever in the history of the NHS. So I think that the government has held back the publication of this workforce plan. I don't know what influence they've had on it, but if I were doing a workforce plan, I would be going into far more detail. I'd be emphasising retention. I'd be saying, what can we do here and now? And I think they've timed this release in a way almost like a vanity project to hit one of Rishi Sunak's 5 targets just about a year before the general election, and there's no time to test it.
One of the proposals and the way to accelerate getting more people into the workforce has been to cut doctors' time in medical school from 5 to 4 years, introduce medical apprenticeships. Now, the BMA and the Hospital Consultants and Specialists Association, the HCSA, have expressed some unease about these proposals, saying that they are worried that it could dilute the calibre of doctors entering the service. Would you share that concern?
Yes, I would. I think one of the when I was a junior doctor, I was doing the classic sort of 90 or 100 hours a week, and you do a 4-day weekend and end up almost unable to think or stand. But you did actually see a huge amount of rich clinical experience over a whole weekend, following the pathway, for example, of a child with meningitis from presentation right through, hopefully, to treatment and recovery. If you have quite rightly now the shorter shifts, on the one hand, they're working very intensely, and on the other hand, that they don't necessarily get the continuity. And what you really need is very, very good training. You need more consultants, you need training time, you need people doing lecturing jobs and seminar work with groups of students. You need to support them so much. Now, if you cut the training by a whole year, you do two things. You pressurize those students again, and you turn them out into the maelstrom of what it is in the NHS at the moment. But you also may potentially undervalue the degree that the doctors come out with. Will they be compared with doctors who worked for the 5-year degree and therefore undervalued? So I would worry about that. Without a huge commitment, and this should be part of a workforce plan, to increase the training and support resources that in universities and in training hospitals. And
finally, Doctor, would you say, in terms of getting those waiting lists down now, because obviously this is a longer term thing, what do you think the most important thing the government could do to make a significant change to waiting lists going into this winter?
Well, I'm afraid that I'm repeating what I said before. I think that the billions of pounds that are being wasted in other directions on the health service, we all know about the money wasted in COVID, but there's an ongoing waste of $3 billion a year on agency staff, 10 billion contract for 4 years given to private hospitals. They should invest in the health service. They should invest in the staff that we have now and say, yes, you are right, we have devalued your pay by 20 or 30% over the last 10 or 13 years, and we will recognise that, and we will say, you've worked incredibly hard, you saw your colleagues die during COVID, and you are worth that money. For me, that's the single most important thing that would immediately address the vacancy rate. It would stop the loss of people, it would retain staff, it would increase morale, and you would actually begin to turn the line around.
Dr. Tony O'Sullivan, co-chair of the Keep Our NHS Public campaign, also a retired NHS paediatrician, grateful for his assessment of where we are.